Welcome back. On today's East Jefferson General Hospital Medical Moment, Camille Whitworth introduces us to the role of a primary care physician and weight loss. Take a look.
Right now, Louisiana ranks third in the nation when it comes to obesity. And what's more, almost half of all people who live in Louisiana over the age of 45 are obese. Well, here at East Jefferson General Hospital, primary care physician Dr. Donald Faulbacher really has woven weight management into his practice, and he talks about ways that you can be healthy.
When you look at a lot of the comorbidities that stem around obesity, it's something that we really need to address, but in time of family practice, it's one of those things that's difficult to talk about because it makes the patient uncomfortable. It kind of makes us uncomfortable, but it's something that I do think that we need to bring to the limelight because we can fix a lot of comorbidities similar, like hyperlipidemia, diabetes, high blood pressure, sleep apnea. All these things are fixable just by losing weight. So bringing them up to the patient, bringing that subject up to the patient is very important, but you gotta have a little bit of technique to do that because it is a touchy subject. So you gotta kind of ease into it, really mainly by starting out, how do you feel about your weight? Or have you ever thought about techniques to lose weight? Or have you ever read about certain diets, anything that interests you? And I always start out, do you have a goal weight that you would like to attain? And then that kind of eases you into this the scenario of how are we going to address that.
Let's talk about weight loss and how does that impact our overall health?
It's definitely going to increase the longevity of your life and quality of life per se, because that's the most important thing. Because we can keep your diabetes under control. We can keep your high blood pressure under control with medications, but if you're still carrying that weight around, it's going to put some damage on your joints, your back. So yeah, you might be living a long life, but we would rather you live a comfortable life and not, put up with all this pain in the joints and stuff that can be attained by just losing a couple of pounds. And overall, medicines aren't perfect, so when we do give you a medicine, there are side effects to medicine. So we do have to watch kidney function, liver function. Well, if I can make you lose a couple of pounds or help you lose a couple of pounds, I can get you off these said medicines and improve your life and maybe your pocketbook a little bit.
The big question a lot of people have, do I have to lose a lot of weight for it to make a significant impact?
Everybody's different. That's the thing. If you look at the measurement we use, it's BMI. It's not a perfect science because it's all based on height and weight. You look at me, I'm short and kind of wide, so my BMI is a little higher than it should be, but you need to take that into consideration, and you need to kind of see what the patient feels about their weight. How do you feel about how you look? Is there anything that you would like to change about yourself? Because it's really all about perspective and having the patient feel comfortable in their own skin. If they feel good at a certain weight and their labs and health, go along with that, then hey, I'm not going to fault you for that. Let's just say you're 40 pounds overweight per se. And a lot of people want to get that 40 pounds off right away. Well, my biggest fear is the quick weight loss, because with quick weight loss comes quick rebound, because 9 out of 10 times in the first month or two, if you lose over 20 pounds, 50, 60, 70% of that's going to be water weight, and as soon as you get back on your regular diet, all that stuff's going to compound back on. So what I like in my weight loss program, if we're going to be aggressive, and this is being aggressive, 2 to 3 pounds a week is pretty quick weight loss, but attainable weight loss. If you look at it in a month, if you're losing anywhere from 5 to 10 pounds, I'm happy. In the very beginning, you got to expect a big drop in weight because most of it is water weight, but you're eventually going to hit a plateau. And if you're anywhere from 3 to 5 to 6 pounds a month, you're heading in the right direction.
Okay, couple of things. Maybe your top 3 tips for weight management?
Yeah, so if we're gonna start the weight loss journey, number 1 is have a goal. the size clothes you want to wear, what weight you want to be, and most importantly, when you want to start it. You need a date, you know. You need a date and a little motivation. So I always tell people, just like when you stop smoking, put that date on the wall. All right, if it's going to be January 1st, which is the most popular one, I want that on your mirror in the morning, and I want you to see it because I want that to motivate you. This is when it's going to happen. And most importantly, have a support system. If you get your wife involved or your friends involved, and then reach out to a professional, be it a dietitian, a nutritionist, a doctor who's willing to kind of talk to you about these kind of things, and set a game plan. So most importantly, set a date, set goals, and find a good support system. And then look into what diet fits your comorbidity, most importantly, because diabetics really can't do certain diets, whereas hypertensive patients can't do certain diets. So you really need, there's no cookie cutter method to weight loss. You just need to find somebody that's going to tailor it to your needs and your comorbidities and your ailments.
Talking about weight loss often is not a very easy thing to discuss, but you may be surprised that once you get started, you'll find out that the benefits really happen fast. It cuts down on things like diabetes, blood sugar levels, and even hypertension, and much, much more. So the sooner you get started, the sooner you'll be on your way to a healthier lifestyle. I'm Camille Whitworth. Thanks for watching.
Thank you, Camille. As always, visit ejgh.org to find out more about Dr. Fabacher and other primary care physicians at East Jefferson General Hospital.